Hi, colleagues. The WOA convention was this past weekend, and I wanted to hit up a couple highlights from the weekend. The first was that the WOA has decided to become a lead state for Think About Your Eyes. That means every WOA member will be listed on thinkaboutyoureyes.com. If you're not familiar, this is a national marketing campaign to increase awareness for the need for yearly eye exams. It's been around for a few years now, and it has absolutely increased the amount of eye exams for across the country. These programs have actually shown that in areas that they have been marketed, it's driven 25 additional patients per year to every doctor. And so, on a national level, or on a personal level, to participate, it's $250 for a basic listing and $500 for the more advanced listing. Because the WOA has become a lead state, that makes it only $50 a person. So, in order to afford this, the WOA has decided that there will be a $50 assessment on the 2017 dues, and this will allow us to actually fund this program. If we were to do it without this assessment, it's about a $30,000 line item, and our association simply doesn't have that money. So the $50 assessment is a great thing. So when you see that on there, it's to go to fund Think About Your Eyes and increase patient volume for your practice, no matter what mode you're in. This is an absolutely awesome program. So that was one of the big things and one of the biggest positives, I think, of the weekend. The other item was basically a call to action. Our profession is under attack. As you're aware, there's online eye exams now where people are getting a actual refraction online and paying about $50 for it, and then they're able to get glasses prescriptions and even contact lens prescriptions without ever seeing a doctor in person. And this is an absolute tragedy from a patient safety standpoint. It's bad for our practices and it's bad for public health, and it needs to be fought. So we need more dollars, and our political action committee has been, or political action funding has really kind of been on autopilot for several years now, where we just haven't had any big threats to the profession. We've all been, taking it easy, and now there's lots of threats. There's the online refractions, as I mentioned, and there's also movement by groups like 1-800-CONTACTS to completely deregulate contact lenses. Therefore, there would be no prescriptions. You could write anything on a piece of paper, and they could go fill anything they want. So there'd be no branding, there'd be no expiration dates, so patients could go online or to any place and just say, hey, give me some contacts, I'll take a -3, and they'd fill it, and it would be completely deregulated. So again, an absolute horrible thing for patient safety. So we need to fight this, and we need more money. On the WOA level, our PAC is supported by only 20% of our members, and that's ridiculous. We need every member of the association to write a check, whether you can write $1,000 or you can write $50. We need the money. We need that to open up the doors so we can talk to legislators, so we can get pro-optometry legislators into office, keep them in office, and help protect the public and our profession. The AOA trustee came this meeting and mentioned that the AOA PAC is supported by even less than what the WOA PAC is, and right now we have $1.5 million on a national level. If every AOA member donated just $50 to the AOA PAC, we'd have the most powerful lobbying PAC in the entire country for healthcare. And that is such a small number that it would be so easy for all of us to send $50. It's a travesty that we're not sending more. But if you can send anything to the AOA PAC, we need it. And the WOA PAC, we desperately need it. So that is the more urgent news from the convention. Of course, we had great CE and great camaraderie with our friends and colleagues, so we had a great time. But the big things are Think About Your Eyes was awesome, and the next thing is we need to support our political action committees on the state and national level. So you'll see a link to both of those in this email. Click on those if you haven't donated, and send some money. We absolutely need it. Have any questions, send them to me, or of course the WOA office, and those links and phone numbers are in this email. Thanks a lot, guys. Have a great week, and I hope to see you at the next society meeting.